OxyGen. Expect more.
Well, there's a lot of aspects of the Geneo that is very unique again, and in my opinion is a big improvement and a step up to our traditional treatments. Microdermabrasion was brought in the market like over a decade ago, and it was a great treatment at the time. Again, it's a sort of a dated treatment now, and what it does is instead of using this natural flushing of blood, which the Bohr effect creates, it uses vacuum to get the blood to the surface. So people are vacuuming along, usually with grit or a diamond tip, for instance, and there's several issues with that. Yes, it does abrade the skin, which is lovely, but if you're using vacuum on the face, and this is with any vacuum modality, well, you risk the chance of dilating capillaries even further. A lot of times in aged skin, we have little angiomas, little red spots. If someone had acne, they have vascular macules and red spots on the face, capillaries in the nose area. And if you're using something with vacuum or around the sensitive eye area, you're pulling and tugging and forcing blood into an area, and that might not be best for all skin types, especially with acne. We are trying to reduce the redness in the area because of the scarring, and in that case we're actually increasing it mechanically. So by using the Bohr effect and allowing the body just to naturally flush blood to the area, not just regular blood, oxygenated blood, into the area to bring healing without that mechanical pull or vacuum, you just have a much better, much easier, much safer treatment. Inversing peels, a lot of peels have been on the market and they're great for a lot of different types of skin ailments, and again, it depends on the kind of peel that you're going to be using, how aggressive it is and such, what kind of outcome you would have. But typically, again, with a peel, it's you're applying product on the face, allowing it to sort of dissolve the cohesive gel that holds our skin on, and so it sheds over a period of time. And a lot of people don't like peels because of the shedding. They have it seems like dry skin around their mouth typically, and their skin doesn't look its best for a long time. You're waiting for it to shed. Again, something with downtime isn't really an appreciated treatment, although it does do a great job for hyperpigmentation. Now, how the Geneo versing all of these types of treatments is there's a lot of benefits. Number one, you're having the same type of chemical benefit you would with a chemical peel, because the Geneo product actually has kojic and azelaic acid in it, which helps reduce hyperpigmentation. It's basically the gold standard for hyperpigmentation globally, because globally a lot of places do not allow hydroquinone for usage because of toxicity issues. So globally, you're dealing with hyperpigmentation, especially particularly with ethnic skin, in a very gentle but effective manner. So with peels, you have product efficacy, which is very important. However, you get that same efficacy with the Geneo in a much milder treatment. Now with versing, and again, no shedding. We're doing removing all the dead skin immediately in one service, so you don't have to worry about the peeling process later. Versing microdermabrasion, for instance, we use vibration instead of suction, because we already have dealt with that blood coming to the surface using the Bohr effect. So we have this, what's called the capsogen. Now there's many benefits to the capsogen over a diamond tip or aluminum oxide, which is corundum, which is what a lot of microdermabrasion machines use. So you have aluminum oxide all over the face, and it's messy, it gets in their hair. Most people don't want to inhale aluminum because it's not a good thing to inhale. And the other alternative for microdermabrasion would be a diamond tip. And again, you have to autoclave those diamond tips to make sure that they're hygienic. And really, when a client goes into a spot, did they use an autoclave or did they not? Right? That's a lot of concerns with a lot of people. This is a hygienic tip that is applied for one-time use only for the client's comfort. It snaps in like this, and this starts to vibrate for that mechanical exfoliation. And the vibration in conjunction with the product that's already on the skin causes the microbubbling to take place. The product softens the top layer of the skin, so the mechanical exfoliation works even better. So what you have here is, I like to use the lasagna pan analogy. Microdermabrasion, you have to have the skin very dry, and it's like having a lasagna band with baked on debris, and you're trying to scrape it off. Well, you're going to get a lot of debris off, but chances are you're going to scratch and irritate the pan. You're going to have some marking there, and that's the same as having a fixed abrasion with a microderma or diamond tip. With chemical peel, it's like you soak that pan, a lot of product lifts off, but again, there's no mechanical exfoliation, so it'll fall off in chunks over the next little bit, and it'll still be cleaner than it was, but it's not going to be all off, and the whole process is kind of messy and it's long term. With the Geneo, because you're using both product and mechanical exfoliation, you're getting the instant result that you see is basically the fact that most of your skin is removed in one treatment immediately within the 15 minutes, and in a gentler way, because you're soaking the skin with product which contains retinol, hyaluronic acid, kojic acid, whatever those type of products or nutraceuticals are to correct your skin is being bathed in that while you're mechanically exfoliating. So again, it's oxygenizing, it's infusing corrective product while it's mechanically exfoliating at the same time. So all in all, it's just a much better modality than most peels would be, and definitely better than microdermabrasion.
Collagen. Expect more.